covering local news that matters. This is CBS 17 News.
And welcome. I am Angela Taylor here, joined by Dr. Seth Brody, who is the Senior Vice President for WakeMed Health and Hospitals. Dr. Brody, first and foremost, we want to welcome you. We want to thank you for your time this afternoon. We know you are so busy on the front lines of COVID-19, so we certainly appreciate all you're doing for our community.
Thank you for having me.
Well, let's go ahead and get started. I do want to encourage anybody that's watching on our social media platforms right now, if you've got a question for Dr. Brody, just write it in the comment section and we'll try to get that question answered for you as quickly as possible. But let's go ahead and get our first question started. All right, let's just go to the first question. First of all, Dr. Brody, just how is WakeMed handling this crisis? I mean, this is unprecedented. This is something we've never seen before.
It is unprecedented. Healthcare is a complex world before COVID occurred. So the fact that we have this unprecedented global pandemic, that is now, struck all of us here, it makes it even more complex. But we've been responding for many, many weeks at this point with plans for both how do we handle this from the inpatient perspective, so on the hospital side, and how do we handle this as well on the outpatient and the ambulatory side? How do we continue to take care of our community during this COVID crisis? From the inpatient hospital side, there's all kinds of planning. I can speak in more details about parts of it, but in general, it's about building capacity. So making sure that we plan for the increase of cases that we think would happen. Whether you can predict those accurately or not is one question, but we have to plan for it and assume that the numbers could be higher. So we plan things like numbers of beds, number of ICU beds, number of ventilators we have, things like that. Then you plan the people around that, which are obviously our most critical resource is all of our healthcare workers. How do we have the right numbers? How do we expand those numbers? And then, as you've heard constantly on the news, and it is a really big issue for all of us, is how do we protect our healthcare workers with their personal protective equipment, the PPE that you hear about so much. So those are all critical issues. So we work constantly on that, making sure that we shore those things up, that we have enough PPE to last us and to keep our folks safe. You also then, it gets really complex because you have the whole testing issue on there as well, and how fast you can get tests back and who you can test. And those can be limited as well at times, so you have to also pay attention to that. So it's really a mix of things as far as the hospital is concerned, but we've been planning. We have something called our Incident Command Center, and all of us meet from all the different fields that have to do everything within a hospital system. We plan and meet and daily, multiple times a day, and try to go through all of this and strategize as to where we head next and what are our long-term plans, what's our plan for 3 hours from now, to what's our plan next week, to what's our plan 4 weeks from now when the numbers could look very different. So there's a lot to say about the inpatient world, but it's interesting that people need to realize that for more than 80% of folks that become COVID positive, they're not managed in a hospital. They're managed outside of the hospital in the real world. They get better at home, thankfully, which is great, right? So they're going to be asymptomatic crowd, people who don't really know they have it. There could be those who know they have it, but that are just mildly symptomatic, and even moderate symptoms are often able to be managed at home. And that's the largest chunk, that's the vast majority of the population. And then one thing to think about with that is people still have all of their other medical conditions. So hypertension has not gone away since COVID got here. Diabetes has not gone away. People having heart attacks or strokes, moms having babies. All of these things are still going on. Children need their vaccinations. So I could go on and on about all the things that that already happened. They're still happening. So we have to figure out in the outpatient world, how did we respond to COVID in that way, especially in the setting of keeping everyone safe with social distancing. So how do we now do that You have to do social distancing, but you might need to see your doctor.
Well, Dr. Brody, a part of my interruption, but you brought up a really good point. So hypothetically speaking, if my child gets sick, an ear infection or a high fever, do we recommend them going to the doctor or the hospital, or is it best just to call and maybe do a virtual type of face-to-face with the doctor? What do you recommend?
Yeah, so that's, I think this rapid shift to telemedicine and virtual care, which happened essentially overnight, is really foundational to this response. So if you had a child in that example, I would say, and this is what we're telling everyone, is you call first, and then we can appropriately triage you in that way. So we may say, okay, we hear what your symptoms are. We think a virtual visit is perfect for you. You stay at home in the safety of your home, and then we will do a virtual visit with you. We have both virtual urgent care type visits that are set up through our app, and then now we have virtual medicine set up through all of our service lines. Every single one of our practices across all service lines can do virtual care. So in those settings, we want to keep people home, in the safety of your own home. If we can do it via virtual, we will. However, if we also talked to you and said, boy, this sounds like we really need to see your child in that example, because it sounds like it's urgent or truly essential that some type of exam has to be done or a radiologic test must be done to provide safe care, then we would say, okay, I think in this case you need to come in, and then we have safeguards around how do we do that safely for you to come in. So that's how I'd answer that.
So let's talk about COVID-19 patients. You said most of those are at home riding out their symptoms. At what point should you go to the hospital if you have these symptoms?
Yeah, so I think that's the other part where virtual health, and we're using it a lot, is to follow our COVID-19 positive patients. So number one, if you can get into that kind of system, I would say that's the best thing, because you can ask your healthcare professionals, my shortness of breath is getting worse. My fevers are getting higher. I'm now having chest pain with my shortness of breath, right? I mean, usually it's respiratory symptoms that are going to bring people in. There's a lot of symptoms that go along with COVID now, but those are the ones that really start to concern people, is when the fevers remain extremely high and the shortness of breath is worsening with a constant cough, things like that. But again, there are many other symptoms that come along with COVID. So I think what happens with virtual care, which I think is fantastic right now, is that you can check in constantly. And if we know that we're worrying about somebody, particularly someone who might be in a high risk group, we can say, hey, look, I want to follow up with you tomorrow again, because I really want to watch you closely. And then we see something turn, we can say, I think it's time for you to come in. There's hotlines all over now that you can call, and patients can call and say, these are my symptoms. We're also setting up, and I didn't mention this before, but we now have respiratory centers set up at all of our emergency departments that are sort of separated. Some of them are the tent versions that you've probably heard about on the news. So if somebody really feels sick, they can present to one of those, and they will get their workup in that area where it's safe to be done, and they can get their entire workup. And if testing for COVID is appropriate, they'll do it there, and they can even initiate other treatments, and they would determine whether you need to be hospitalized or not. So if someone really needs acute care and doesn't think they can do a virtual visit, and they needed to just come in, we now have that set up at all three of our emergency departments, and we're thinking about expanding it even further.
That's fantastic.
So that's another thing. That's another thing WakeMed has done.
That's fantastic, Dr. Brody. Another quick question when we're really talking about emergency rooms. If somebody does need to go to the emergency room and it's not COVID-19 related, is that safe to do so? Yes.
So that's sort of what I was talking about. So what we've tried to do, and this is a challenge, that's why you're asking the question, is how do we separate? Is there a way that we can separate those with known respiratory symptoms that are coming in as people that what we call them persons under investigation, for COVID, meaning they have the symptoms that are fairly classic. Now, again, most of those are testing negative so far here. Not all, but the vast majority, well, 95% are testing negative, actually. So there's lots of other things that cause those symptoms, just like there always has been. So what we've done we're setting up those separate areas for evaluation. We are now funneling the people with respiratory symptoms to those areas. That way, the rest of the emergency department can be for the people who do not have respiratory symptoms. It's almost like you have a sick and a well waiting area in your pediatric office. I don't know if you've seen that, but a lot of times you go to a pediatrician's office and sick kids over here and well kids over here. It's a bigger separation than that, but it's the same. It's sort of the same concept. Let's be able to put the people who might have COVID over in one area and keep everyone else who's coming in with a badly sprained knee or something else. They bump their head or whatever it may be, or abdominal pain or chest pain. They'll be put in a different area. So that's how we're approaching it. We're trying to separate those folks and decrease your exposure risk in that way as much as possible. That in the setting of community transmission, which means you could be exposed at your grocery store. Right. But we are trying to separate folks as much as we can.
Hey, it works at the pediatrician's office, so that's good that you're doing that. Yeah. Dr. Brody, we continue to say social distancing, washing your hands, and I don't know if we can say it enough. Just talk about the importance of that.
Yeah, we probably can't say it enough. The social distancing is really key. So is the washing hands. Both are equally key. What we're trying to do, and you've probably heard this, is flatten the curve. That's been the term that's been said. And what that means is the predicted levels of this infection could go up like this, very rapidly and very fast. So the flattening of the curve is meaning that it will still go up and it'll peak, but it'll peak at it'll be flat, right? It won't go up like this, it'll go like this. And that way we can all manage it. We can have enough protective devices for all of our healthcare workers. We can manage it in the hospital, the proper number of hospital beds and all those kind of things. And we can manage it in a much more controlled way, which is better for everyone. It also means less people overall are getting infected. Social distancing helps with that, right? As we separate everyone, your chance of passing this on, this is a respiratory, from what we know about it today, it's a respiratory droplet kind of infection, meaning if someone were to cough or sneeze and they had it, you could get infected, but it's not because you're just breathing it out of the air, it's because it's on the surfaces of everything around them. So when they do that, you can touch it and you touch your face and next thing you know, you're infected. There's the hand washing part. But we also, if we separate each other by more than 6 feet, your chance of being in that area where that person who may be positive goes down, right? You should stay out of that zone, basically. So that's the theory. And then as people have it and get better at home, they're not out infecting others as well, infecting the community. So you have people staying at home, not infecting the community. You have people staying away from each other for those that you may or may not know that have it. So it kind of it's common sense, really. I mean, and it works. It has flattened the curve in several parts of our country, and it has flattened the curve across the world in areas that did it early. So washing the hands is obvious as well. You have to wash them all the time. You touch a door handle, you have to wash your. You probably can't wash your hands too much at this point, because anything you touch out in public theoretically could have it. So you really got to avoid touching your face, your nose, your mouth, and make sure you wash your hands very frequently.
Well, Dr. Brody, we have a question from Teresa. She wants to know about pregnant women. I know at one point they weren't at high risk. At another point they were. Then we heard they weren't. And so what's the latest information when it comes to pregnant women and their babies?
It's a great question. Very near and dear to my heart since I'm an OBGYN. If you ask an OBGYN, meaning myself and others, anytime there's a respiratory viral illness, I would have told a pregnant woman, you're in a high-risk category. Whether the CDC had announced that at the beginning or they didn't or anyone else did. And the reason is, look at the flu, for instance. It's one of the reasons we push flu vaccinations so hard for pregnant women to make sure they get it, because they tend to respond more poorly. They can get sicker than non-pregnant women. So we know that about the flu. So if you told me there was a respiratory viral illness spreading across the world, I would be concerned about pregnant women. And I would say, let's do everything we can to have you avoid it. Now, what's interesting about this, so my point in saying that is, I think by definition, pregnant women are going to be in a high-risk category. With that said, the data to date is not showing that pregnant women are responding worse than the same age women that are not pregnant. It seems to be about the same right now. That's to date. Now this is a new illness that we're seeing, so that makes everyone a little nervous about being overly confident about that statement. But to date, and what we've seen, it does not seem to be impacting them worse, which is interesting. There's a lot of strange things about this pandemic. I'm glad to see that data. It's reassuring overall that pregnant women are not actually responding worse to it. But again, it's one of those things, do we know enough? And we're always, we're always careful when we talk about pregnancy. So that's some of the confusion and the back and forth that you just described. I agree. I think that the messaging has gone back and forth. But that would be my answer to explaining why you've heard mixed messages around it.
Okay. Dr. Brody, we've got a question from Melanie, and she wants to know, there's a lot of information about testing and research, and she's heard something about this antibody testing. Is there anything like that available in the U.S., or could we see that here anytime soon?
So that's a great question. And it's very, in my mind, it's very forward thinking, right? Because what we're talking about now, all of our testing that we talk about is just, do you have it or do you not? But that's very different than saying, what you'd love to know is, am I immune to it, right? Almost like varicella, chickenpox and things like that. I want to know, you can get a test and you're immune. Great. They are studying that now. It exists in other countries. They're absolutely working on that now. And I don't know when this will be available. I'll just be really honest, but I know there's so much work going on in this regard now that I think it's coming relatively soon. We certainly would want to know that if we thought this was going to come back in the fall or what have you, it would be great to have immunity testing available. And the reason that's so important, and if you think about it, you'd be able to start to test the population and figure out who developed immunity and who didn't, and that would really change our entire approach next time. So when this, just like the flu, when it comes back, you'd know that, oh, you have immunity that's built up and you don't. These folks can go to work, these should probably not. Or these people need a mask, maybe these don't. I don't know what the policies would be, but you can see where that could head. All kinds of directions and how it would help the entire country, potentially the world, if we could figure out a way to determine immunity status. I do think there's tests like that coming. They're studying it very aggressively right now. That's a great question.
Well, Dr. Brody, is there anything that the community can do for WakeMed right now in terms of homemade masks or really anything just to support your doctors and nurses and your other staff there?
Yeah. First and foremost, it's the things we talked about. Abide by social distancing and wash your hands. I mean, the lower rate we have of people that get this, the better it is for all of our hospitals in this area, WakeMed and everyone else. It's just better for everyone in general. So that's the first thing I would say. Donations are a little tricky. We love it that our community wants to donate. We could not thank people enough. It does get a little complicated when it comes to things like masks and those sorts of things, because we want to make sure they're the right kind of masks, that they actually protect our people, and we don't put something on them that they think they're protected, but then they're not. Things like that. We have taken some donations from large, like construction companies that have N95 masks, things like that. Those those are really valuable. And we're taking some donations. Some we have to evaluate and say, not so sure. The CDC is studying homemade masks right now, actually, and whether they have value or not. So everything I'm saying today, just like everything when it comes to COVID, we always say this. It's a sad statement, but we say one thing one day, and 24 hours later, a new report could come out, and we change course. I would say homemade masks are one of those things that could be possible. We've been saying to this point, for the reasons I just said, we're not going to use them right now because we have medical masks available still, and what would it mean to use them? But the CDC is studying that on cloth masks and all that, and it's possible that a week from now, they come out and say, hey, if you're short on your other masks, go ahead and have people wear their masks from home. But that would be in the future. It's certainly not today. But we have a line that you can call in and ask about your donations. We can get that information. It's actually an email, info@wakemed.org. And you can email what you have to donate, and now our whole team that is managing our donations that are coming in from the community can tell you what to do.
Fantastic. Dr. Brody, we know you're extremely busy. We want to get you back to your day. Just if there's any final message you would like to give our viewers, here's your chance.
Yeah, all the things we talked about, stay on your social distancing and washing your hands and again, I think some of the things we've talked about really lean into that, calling for telehealth options, calling ahead, they'll direct you how to do it. You have symptoms of COVID, you have other symptoms for all your other healthcare conditions. I think calling in and, we're here. It's on our website, all of those things. We can guide you in that direction and let you know whether that's appropriate for you or not. We don't want people sitting at home with their non-COVID healthcare conditions, their normal stuff, afraid to call, afraid to come in, and then getting sicker in that way. We have to realize we have to take care of this whole community and population. We don't want you getting sick from your other stuff that you've had, right, all this time. We don't want to ignore those things, sort of become, tunnel vision, COVID only. We've got to be able to still care for people. So don't be afraid to call and reach out. We've got lots of ways we can see people in the safety of their own home.
I was going to say, Dr. Brody, I love WakeMed because WakeMed chart is online. It's very simple for us to just go on there and ask our doctor a question if we need it. It's very simple, and they get back to you very quickly. So,
great.
Yes. So thank you. Again, if you've got a question for WakeMed, info@wakemed.org. That's the email address Dr. Brody has given you if you've got questions about donations or whatnot. Again, Dr. Brody, we thank you for your time, and we so appreciate your staff and nurses and doctors for what they're doing on the front lines of COVID-19.
Thank you. We got a great crew here. Thank you very much.
Thank you.